10 minutes are going to be allocated to each topic, and the way it'll go is that the pro person will get 4 minutes for their primary position statement, followed by 4 minutes for the con primary position statement, and then 1 minute rebuttals back and forth. This is going to be strictly timed. There will be a buzzer. There you go. That means you are out of bounds. You just got to end what you're saying at that point. And this is no holds barred. They can get personal, and I hope they do. So we're going to start off with collared versus collarless stems, and the position statement is collared stems are clearly superior to collarless stems. The pro position will be Gillian Soles, and the con position will be Steve Lochow. Gillian, you get the floor first.
Okay, so we're talking about collarless versus collared stems, and I don't know if my colleague reads any journals, but there was a large study with 48,000 patients out of Australia, and they looked at the difference in revision rate for fracture or loosening over a 7-year period, and they found that there were increased revision rates at 3 months and increased fractures at 6 months for the collarless stems, because it resists subsidence. Now, yesterday we all saw how Urosimides took a simple 3-pound mallet and pounded on a stem and got it to loosen a little bit so that he could get it out. And I would argue if you take one of Heidecavich's carbohydrate, what did he call it? They had carbohydrate resistance or carbohydrate poisoning disease, and they start stomping around, I'm sure their legs weigh more than 3 pounds, and so the stem might subside, and now the leg length is a little bit off, and the common complaints patients come into the office and they're like, Doc, you did my hip replacement, and now one leg is longer than the other or shorter than the other, and you get all these complaints. And if you just simply do the surgery, plane down, put the stem with the collar, it'll sit exactly where you put it. It won't move. Your patients will be happier. They won't loosen the stems. They won't need to be revised. I have other scientific evidence to back me up too. There was another meta-analysis. They looked at 480 studies, a few of those, 40 of them qualified, and they also noted lower revision rates with equivalent or better radiographic outcomes. Sure, your x-rays look good, but if you have to take the patient back to the OR, that's no fun for anybody. And that was because they had increased axial and rotational stability and less subsidence. And finally, if you don't believe any of those clinical studies, you have to believe biomechanical studies where they did a finite element analysis, and they showed that there was more stability even if you had a small gap. So, you got the collared stem, even if you have a 1 millimeter gap, they compared collared sitting on the collared with a 1 millimeter gap, and collarless, and both the collared ones outperformed the collarless stem. So I'm saying here, there is no argument the collared is clearly superior. I think I might be out of time now.
No, you're good. All right. Right. So great. So it made you quoting those articles made me think of something Joe Mata likes to tell us, that sometimes you don't need a study to try to disprove common sense, right? So sometimes common sense tells you all you need to know. So for this, all I did is went to ChatGPT and said, hey, who's superior? And it's pretty amazing. I thought there was no chance ChatGPT would be able to talk about collared versus collarless stems, and by gosh, it does. So that's something interesting to go check out. So I have multiple points that I can make why collarless is better. First, collarless is easier to put in, right? You don't have to worry about, if you put a collar on a stem and you undersize it and it sits on the cow car, that's sometimes hard to judge. And if your stem's too small, I don't care if there's a collar there or not. It can still subside. It can go into retroversion. They talk about rotational stability. I don't buy it, Collarless is more forgiving to different anatomies, right? So you can put that in about anybody. I even read an article, they talked about the collar can impinge on the iliopsoas. So there's something else I hadn't even ever thought of. There's another problem with collared stems. They talk about biomechanically, a collarless stem has less stress shielding, right? So it's more anatomy friendly, more physiologically friendly. And so the last point that I'm gonna make that I think is actually the most important one about a collarless stem. So we're doing anterior hips. Everybody in this room's here interested in anterior hips, and that kind of makes our patients a little bit younger, right? That's just me thinking about our practices. You know, it's very common. I have a 55-year-old with good bone. Our patients have good bone. So I use a collarless stem in all those younger patients because there's a chance, and we've learned this weekend, that each year the revision rate creeps up a little bit as people get older, and we all know it is so much easier to take out a collarless stem than a collared stem. You know, a collarless stem you can have out in just minutes. If you've got a collared stem, that's a whole different animal. So hopefully that proves my point. Collarless stems is the way to go.
Steve, you ignorant slut. As a final point, please show the founder of the Anterior Hip Foundation's remarks on this.
Why would anyone use a non-collared stem?
My simple rebuttal is the instructions were no PowerPoint, no videos. So if you had to resort to that, that's cheating.
All right. Very good. So go to your Whova app, look at the poll, vote for the best debater for collared versus collarless stems. I'd like to thank Gillian Soles and Steve Lochow for starting us off right. You will be awarded the winner at the end when we give out all the prizes. At the moment, and this is good, we're keeping things going.
I never thought I'd be called a slut on the stage.
It's about time. Everyone's too intimidated by your size to call you that.